We enjoyed that ride. Okay. I'll call the meeting to order. Are we going to have Ron with us today?
I haven't heard from him. We sent him the packet and called him. But there wasn't any confirmation of him attending.
Okay, even by phone, he hasn't checked in, so.
Correct.
Okay. Well, the roll call is that we have 4 members and Amy.
Vern McGinnis,
Here.
Mary Casely, Jan Hood, Phyllis Bursty, and then Ron Moorhead. So Ron is the only one that's not present.
Okay, do we have any appearance by members of the public in any way?
No.
Okay. If that's the case, then we'll move to the notification of paid allocations on the consent agenda. It was fairly short, if I recall.
I have a question.
Yes, Mary.
The expenditure for $1,164, what was that for?
So for that fund balance of the 110, I think that the 1164.33 is for, I'm not sure if that's for partnerships and health. I'm not sure. I would have to check in with finance to see what that fund code is for.
What would we be paying? What would be the reason we're doing partnership? Not that we shouldn't, but partnerships and health, what does that entail?
So for it would just be the funding allocation for the month. So for April,
Is that to the wellness center?
yes. So it would just be the regular monthly payment, but I'm not sure if that's what that is for.
No,
There
on
you
one-
The sheet that I have, that's Easter seals.
Thank you, Ron. Thank you, Vern. I just saw that. No, that was Easter Seals funding allocation. Thank you, Vern.
April 8th, yeah. Okay,
prepaid.
Okay. I didn't read the smaller print.
Mary, I was with you. It was a little bit confusing because on one page it just said that information, and then on the second page of that report, the committee report, is where it says that it was paid for Easter Seals. So that's just their monthly
Okay.
allocation.
does that require approval now?
Yes.
Okay, a motion to approve,
So moved.
a second?
I'll second it. Jan.
Or any further discussion? All in favor, say aye.
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 Opposed? Motion's approved. Okay, we can move then to our information items. And one of them is the EPIC program, and that's on the agenda because I had had a conversation with Laura Furlong a few months ago, and in our discussions where she brought the EPIC program up as something that she's kind of following and interested in. And so I asked Amy if she could go ahead and get some information for us. And so there is one page there about that. And it kind of fits in with the environment that we're in. Really, part of today, I think, is discussing about how are we going to function within that kind of an environment. it's really already changed some things for us and changing our contract the last time we had a meeting, but this is about Epic Homes, and they do apparently have some activity going within McLean County. I just don't know how many homes within McLean County that they do support, but so given that, why I'll just throw this open for any kind of commentary or discussion that we have for today. It's not a new organization, it's 35 years, so.
Do we know how many are in host homes in McLean County?
It doesn't say so in here, and I hadn't any information about that from anywhere else, so no.
And
Let's
Jan-
say there's 80 people in homes across 12 counties, so.
4 counties.
I think this is a newer program coming to McLean County. And so it's still in I think the initiative early stages. And so I'm not sure if there are any homes in McLean County yet hosted by Epic. I think they're just kind of getting rooted right now.
Yeah. Depending upon what we share with what we want to support, if there's something that attracts them, they would be able to go ahead and apply just like anyone else would. So I think this is just for information purposes. It was new to me, so. Anything further on that, or we can move on?
Let's move on.
Okay, at our July meeting, it's been for us each time to go ahead and review the bylaws, and for about 3 years in a row, while we were in the process of redoing bylaws and updating, and I think we had some minor changes to it last year. That's why the bylaws are included in that. So is there anything now that we go through this, especially maybe how we're maybe going to do some things perhaps differently? Are there any things that come to mind, or anything that we should put out on the table to talk about?
I have 2 minor questions.
Okay,
Under Article 4 meetings, it says number 2, special meetings may be called upon a majority vote of the board or by request to the health department director or their authorized representative. We have talked over the years that we're part of the health department, we share employees, but we answer to the county administration. And so, would it not be appropriate to put a slash in there after health department, authorized representative, and say county administration? Or am I making myself as clear as mud?
no, I understand what your point is.
I think that makes sense. To add that.
County administration?
Yes.
Would it be health department director or county administration?
That's fine.
Should we also include board president?
Well, would that not be included in the majority vote of the board?
So I was thinking majority vote of the board would be, like, the board would have to vote, say, like, the majority would say, like, yes, we want to have a special meeting Or sometimes it may just be the board president saying we need to have a special meeting.
Board president may say, I think we need a special meeting and therefore we would need a majority vote of the board.
Okay.
No, that's my point. I wasn't saying that we shouldn't have that, but
No, and I think Ron, or I think, sorry, I keep calling you Ron. I think Vernon like is
I
have
need to
to,
get my name tag up here.
sorry,
Chief.
it's Friday. I think it would be up to interpretation too, like, and you're right, like it may just mean like where it says majority vote of the board, like we would have to have the majority of the board that present in order to have a quorum. But then I was also just thinking, did it mean like if the board president was saying we needed to have a special meeting? So, and I'm not even sure if it, you're right, it may just be implied within that, the
I
majority.
think it's almost implied within that. Yeah.
Okay, sounds good.
And then my other question, which is not a change, but I realize we're in unusual times, but it has there been a annual report which has come out since the 31st of December 2019?
Yes, so the annual report comes out, it's due March 31st of the following year. So the annual report came out like within the health department's annual report. So the annual report, the 377 annual report just was, just had the total amount of funding that went to contractual services, how much was allocated. So it was just a summary of a lot of the funding allocations of the money.
So it wasn't an individual report in itself.
No, it has to be,
Or
it had its own, or its own sheet within the health department report, and it was specific to the 377, but it has to be published. And so part of it being published was just including it into the annual report so that whoever wants to access that can access it.
You did not send it out via email, though.
No. You guys want to see the annual report, the 377 board annual report?
I think that would be good.
I do.
Okay.
Will you email that to us, Amy?
Sure.
Okay.
Okay.
The only kind of comments that I had also on the bylaws, and so the Mental Health Advisory Board has been working on their bylaws. And so they've been adding language into theirs as far as making it clear, having clarity on like board participation, like how to, just some of like the logistics as far as, now my mind's going blank, just some of the logistics. So I didn't know. So it sounds like the bylaws will have to be part of next meeting's agenda so that we can correct Article 4, the county administration, because there would have to be an action item to approve that. Do you want me to look at what some of the language was from the Mental Health Advisory Board as far as like logistics and present that to you guys to see if that would be something that you guys would be interested in adopting into the 377 board bylaws, just to have some clarity on different procedures? And I'm sorry, I can't remember everything. I know it was regarding member participation. It was regarding like new members, but I can't remember all of it. I would be happy to, if there's going to have to be a process, the approval process to amend the bylaws, then I would be happy to share those with you guys next meeting, just to see if those would be something you're interested in. And if not, then of course it doesn't have to be something that would be interjected into the 377 bylaws.
Okay, Amy, that would address one of my concerns, is the lack of participation by board members. You know, we're a very small board. you know, and if you're gonna be on the board, we need to hopefully hope that you're gonna be present at most of the meetings. And we have nothing in the bylaws, do we, regarding number of meetings missed or whatever?
Jan, so right now, that's not in the bylaws,
Yeah,
but I can, and it's also not in the statute stating member participation, but it's something that could be adopted by you guys as far as expectations on meeting attendance. And so I will be happy to share some of the language. And I can look at the Board of Health bylaws too. But I'll be happy to share some of that language with you guys during next meeting. So you can look at
it's a
it.
very, very tender topic with, you know, because the individual has some health issues and so forth, but, or can we, how do we add another board member so we're sure we have more than 3 at each meeting?
So I looked into, Jeff, my office support specialist, and we looked into the statute, and the number is 5.
Okay,
It's pretty, because there are in the statute, like for example, the Mental Health Advisory Board, there's a range from like 9 to 15. And so you can have more members. But as far as we did look into the 377 board to see, they said like maybe like thinking if we could recruit more members, but it was very specific to 5.
okay, and it's not just McLean County too, or it is McLean County? Talked at one time about,
Happy to.
but I don't think anybody else does.
I do. I
Okay.
think it needs to be addressed because
I agree, Jan.
I think I think we all do.
Yeah, it's just,
Yeah.
it's a hard topic to address, but.
Well, it is, right.
But if something could be changed that we could add one more member, then it wouldn't be so difficult to have a quorum.
But you said up to 5. We can have up to 5.
Yeah, I know, but
Maybe one more, yeah.
okay.
It's too bad we didn't discuss this before we had to sign on and say, yes, we're willing to serve another, 3 years and so forth. Okay.
And
when,
sorry, go ahead.
when is, and this doesn't have to be in the minutes, but when is Member Moorhead's term up? I know we have that information. I just haven't pulled it out.
Yeah.
Mary, what was that again? I'm sorry.
When is Member Moorhead's term up or expired?
If you give me 1 second, I can look. And the other thing too, with like the information that we were talking about, it would be with some of those stipulations, he could choose not to fulfill that full term and still be recognized for his participation on the board, or it would be addressed in the bylaws as far as member attendance. So his 3-year term is up June 30th of 2021.
Okay. Thank you.
Thank you.
Amy, on the mental health committee, could you provide us with that information so that we can review it and see, is there anything there that requires us to recognize that in our bylaws?
Sure.
Or maybe that we wouldn't need to, that it's within our scope of what our activities and what our authorities are. I think you're right about, we'll need to have the approval of the modification we made to the bylaw here on our next meeting.
Yeah, so the process in the bylaws is that there has to be X amount of time that each of the board members will see the edits, the amendments, and all the changes. I'll look at that again. Then it would have to be an action item to be able to make changes.
We've got some other meetings coming up in the fall, so.
Yeah, so I have it noted to put that on the agenda for the changes for the bylaws as far as the county administrator, county administration in that part, and then also just looking at some of the other language as far as the logistics.
Okay. Does that take care of the bylaws?
I think so.
Okay, then the single page item on the 377 board 2021 funding. Yeah.
And that was just to quickly interject, that was just this isn't a new document for you guys. That was just a reminder of where we're at in the process. And so things are going very well. We're on target, especially after today's meeting. RFPs will go out next month in like 2 weeks. So we are headed in the right direction.
Okay. And that all ties in with the official approval of funding in November.
Yes. Yep. And just a reminder, so the health department is working on the budget. So it's such a long process. And so it looks like there will be extra money this year. It's about around 750,000 that's going to be in the budget that's going to be able to be allocated. And it could even actually be a little bit more than that because there's money on balance. And then in November, that will be approved by the county board. But the health department has their budget. There's that process. So the health department's budget is in the process of being created, but that amount has been confirmed with our administrator as far as how much money was provided from property tax levy for the 377 board. So it'll be a little bit more than it was last year. So it'd be exciting to hopefully have new programs coming to the table, and hopefully we'll have more agencies reach out to request funding. And so I'm excited to see how it plays out this year.
Well, and because of the COVID-19, why we haven't spent money that we were potentially going to spend on some meetings and some things. Where do we stand as far as our surplus account right now?
You know, I should have known that was going to be asked of me, and I did not check into it. And so I can't even remember, Vern, what the fund balance was. I think it's a pretty significant amount, what it was last.
Wasn't it around 40,000?
That's what I was thinking. And then we have the forum that will probably end up having, that money will probably go into the fund balance since we won't be able to do the forum this year. Right. And then a reminder, the partnerships and health program. There was 2 months that Advocate Broman Health and Fitness Center did not charge any of their members because the facility was closed. And so that 2-month money that was allocated for that program, that money will end up in the fund balance. And so how much was it for the forum? Was that 10,000? I'm thinking that
I think that was what the number we put against it, just as a, yeah.
So a really rough estimate that will probably end up in the fund balance as of how it stands now will probably be between 50 and 55,000. So there's a significant amount of money in the fund balance, and there's extra money to allocate. So there's a lot of room for opportunities within the 377 board.
Well, I think that's important as we think about 2021 and any changes we might want to make or any things we want to put in our requests for money, or open it up. This is what we're thinking about. Okay.
Yep, I absolutely agree.
Well, that's helpful. Thank you.
Mhm.
Okay, moving on then for items for discussion, the first quarter report, or the quarterly report, I should say. Maybe we could just take these one at a time, Amy.
Sure. So, and if there's any questions as you guys reviewed it, please let me know. But on the quarter one report, which of course was January through March, I just try to put the highlights as usual. And then because of COVID, I just put some of the things that were going on within that program because of COVID. So Easter Seals, just kind of a side update. As of the end of quarter two, they have funding to provide 13 autism diagnostic assessments, and they have already done that. So they have they have flown through providing those services to those 13 kids that otherwise wouldn't have been able to receive that diagnostic assessment. And so I have talked to Julie of Easter Seals, just a reminder that, that the 13 always kind of seemed to be the magic number according to Easter Seals when Jim was in position, and it made a lot of sense as to why 13 was that magic number. But last year, if you remember, it was probably around September, October, they went through the 13. And then this year it was even earlier. And so as far as, I'm assuming they'll probably request for funding for the calendar year 21. And so I did talk to Julie, just really trying to, if that number needs to be adjusted, and if they want to request more funding, if they think there's going to be a need for more to be, obviously there's a need for more to be assessed, but if they feel like there's a need where they can utilize that money so that those kids can make sure they're being served, that they could definitely include that in their application. But of course, it would be up to the 377 board on how much is actually approved. But they will continue to provide the services and do the reports. But I just wanted, the program is doing really well. There's such a need for those assessments, so those kids can receive services through the school and through medical services to get the help they need with their delays. So that's exciting there. They just continue, Easter Seals just continues to be innovative in how they're doing the assessments. They're working with physicians, the physician, depending on the severity of autism, the physician can provide the assessment. And the diagnosis, they're still working with physicians. They're doing everything they can to make sure kiddos are receiving that diagnosis as quickly as possible. Again, because the reason why it's so important to have that diagnosis, and I included that in a report, is because legally they don't really have they don't have any rights to push for services until autism services until that kid has that diagnosis. Was there any questions as far as anything in the report on Easter Seals or the diagnostic clinic that you guys wanted me to address?
No, this is one of the agencies that's very easy to work with.
Yes. Yep. Yeah, I definitely enjoy Easter Seals. And then our other agency with contracts is Mark First. And so we have the supported living. So just as a side note, and I don't think I included this in the report, as far as the supported living contract, a lot of that money is funded towards personnel and providing providing personnel funding for the support specialists. So I'm not sure if you guys are aware of the PPP grant, and I'm failing to remember what that stands for, but that was part of one of the federal stimulus packages. And so small businesses could apply for funding to pay for their staff members' salary if they committed to not laying them off. And then even though it's a loan, as long as they follow through with that commitment, the federal government is not going to request that money back. And so Mark First was able to, a lot of agencies within our community was able to get money through the PPP loan. And so what that means is money that money that the 377 board had allocated towards paying for some of those salaries is actually now going to be provided through that PPP loan. So some of that money has to be adjusted and switched around as far as in the budget of how it's allocated, because of course, if the federal government is going to pay for some of that, is going to pay for those salaries, then the 377 board can't pay for the same thing. And so this is something that the Board of Health agencies is also, a lot of them are taking advantage of. And then there's been, then the way as far as like the budget, there's been revisions to the budget requested, saying like, okay, so we can't use this money for salaries. Can we use this money in other places because of these deficits, because of COVID? So they're not receiving as much money in fee for services. There's higher expenses for technology because of how we're trying to reach out to families. And so I just wanted to bring that up as far as that's what the Mark First contracts. And so, so as you can see, it has on there only 11.8% of the funding was used in Q1. And so that's significantly lower than like on average of, it could have been 25%. And that was because they were able to receive funding through the PPP loan. And so then that gives them opportunity to request for that money that is being allocated from the 377 board to look at other deficits, financial deficits within the program, especially as a result of COVID. Sorry, that was a lot of words trying to explain that. Did anybody have any questions on that?
Did that funding, how far through the year did that funding cover?
So that's a really good question, Vern. So originally it was 8 weeks. And so it started, there was kind of 2 batches. And so the first batch started the end of March. And then I think another batch started in either the end of April or May. And so as far as Mark First, for May, they did not use any funding allocated on any of their programs. They didn't use any money allocated from the 377 board. So I know part of that PPP grant was definitely, it was used all of May, but it was 8 weeks. But then also I would have to follow up with Mark First because there was talk that the federal government was going to extend it into 16 weeks also. So I'm not sure if I know Mark First definitely was able to receive the 8 weeks, but I'm not sure if they were able to receive or even requested the 16-week. So it started around, for Mark First, I think it started in April, all of May, and then some of June.
There's a new potential funding bill being debated in Washington, and I don't know whether this is going to be part of that, if they do this again or not, but it seems to me it's more likely that it's possible to have some of that.
Mm-hmm.
So the same agencies may or may not get that. I know the museum got some money on that, and that's been noted in the paper. So
yeah, and absolutely, and with the stimulus packages, they're definitely is looking out for these small business owners because of COVID and not wanting them to furlough their staff and giving them incentives to not furlough their staff. And the other thing too, as far as like the 377 board and even the Board of Health, there's always this, this very clear expectation that if you can receive funding from the federal government, the state government for some of these programs through fees for services, there's an expectation that they maximize on being able to receive whatever funding that they can. And so kudos to the agencies, including Mark First, for following through with the PPP and receiving that extra funding. So then that way the funding can be allocated in different different ways and deficits especially because of COVID. COVID has hit these agencies horribly in the financial area. But so this is, as far as like the 377 board, this is an area where they were able to receive additional funding towards their programs.
Okay. So would this be a situation where there may be some funding not spent, or are they going to find other places to use this no matter what?
They're looking for other places to use it. I did hear from Mark first within the last couple of days within this week that they're looking at, so as far as like the pediatric therapy program that will be moving soon, they're looking at what is some other equipment that they can utilize to see if that can come from the 377 funding. They have training that they're doing that will be able to allow them to, their social worker to become certified in different therapy areas to be able to provide even more services to the children. And then the more services that the therapist will be able to provide, those are more billable services. So Mark First is just really having a lot of discussions right now and trying to be savvy. And, you know, we receive this extra funding through the PPP loan. And so how can we maybe, you know, move some of this money around within the budget? And it's still in areas that the 377 board has approved as far as equipment, training. So it's still benefiting the program, the scope of the program. But they're looking at moving money around so that way it can be, and then requesting for that money to be moved around so that way it can be allocated to still support those programs.
So we wouldn't need to approve that.
No, that would just be, you guys approved the budget, and then the contract has a budget revision form that they would be able to complete. And then that, so like with the budget, it's a tool that all of these agencies use to be able to try to plan out where their money is going to go. And so they did that in 2019. In the summer of 2019, predicting where their money was going to go in 2020. Well, of course, no one predicted COVID and the PPP grants. And so just knowing that sometimes those budgets, there's going to be different adjustments that needs to be made. So they would do a budget revision form requesting money to be moved within that budget with approved line items. And it would still be beneficial to the program.
Amy, this is Phyllis, but the report says they purchased a new documentation and billing system for all their programs with the money that we provided.
Yeah, so that was, if you remember, that was something that they, that was approved, that was in the budget calendar, or in 2019, that was going to be done in 2020. So if you remember in their budgets that were approved in 2019, that they received money to do those, to be able to do that, get that system.
So they used 2019 funds for that?
No, it was when they did the budget and the application process in 2019 for 2020. I'm sorry, it's confusing. So it was for 2020 funds, but
Okay.
Billing process too was to help their other billing process. Their other billing system was extremely outdated and old and archived, and they had to utilize many different kind of programs to try to do the same thing. And so with the new billing system, they were able to better have a better infrastructure in supporting all of their programs and being able to maximize on fees for services. And so that was something Phyllis, I think it was Phyllis.
Yes, it was.
Thank you. So that was something that was that they had planned for 2020. But some of the they're looking at as far as improving equipment for pediatric therapy, and then just technologies for supported employment and still providing those coaching services. Those are things that they're starting to talk about this year and moving money around, because those weren't things that they were able to predict in 2019 or 2020.
Thank you.
Yeah.
Okay.
So if there's not any other questions on that, as far as like supported living, they've done really well with trying to keep the folks living in the CELAs, trying to keep them entertained and happy, and still getting some physical exercise while maintaining social distance. And so I just included in there, they've done a lot of different things. They have virtual Special Olympics. They're making sure like their houses have fidgets and things to just kind of help keep everyone relaxed. And then Advocate Broman Health and Fitness Center, they did have some coaches do like social distancing at the houses. And I'm sure you saw in the report that then that even got more individuals involved in the program, doing some of those exercises than what was going to the fitness center. And I know the fitness center even did like virtual activities. They did like a drive-by thing with exercising. And according to Mark First, some of the folks living in the CELAs are like, they have more of an appreciation of wanting to get back into the community, including the fitness center, because since that was taken away, they were like, they just want to get out of that house. And so there's some more appreciation, but and there aren't any cases of COVID, thankfully, in any of those houses through March 1st. So that's awesome. Any questions on supported living?
I know the center's back and opening and running. Has there been an increase in the number of people who may be going back to the center for?
And so I did talk to, so I did talk to Catherine Porter this week, and she said that, so there aren't any right now yet back into the fitness center, but especially with this, with the population and sharing homes, they're being very mindful, but they are working together on having a possible plan to see if they can have a few go back into the fitness center. So they are working on that integration. And no concerns, even with, as we move into Partnerships for Health, Carl is now been over the fitness center. And is it Carl or is it Carl Broman? I'm not even sure. But there's no issues as far as anything with the grant or the contract. Carl is very supportive of the program, so it will just be business as usual with the fitness center contract. And so
The supported living program experienced any families pulling their adult disabled children out and having them come home because they haven't, if they were in the supported living, they could not be visited by their family, or they couldn't get out to visit their family, go out, correct?
So there wasn't any report of anyone being pulled out. And they, and you're correct, Mary, and then I'm not sure at what point, but they are currently allowing for visitors, but there's a procedure as far as with family visiting, they have to practice social distancing. And so they have a procedure in place to keep everyone safe so they can still see their family. And then all of the support specialists that work within those homes have been trained to make sure that when they do have visitors that they stay safe. So they are able to currently have some visitors. It's still restricted and more limited than what it was prior to COVID. But I haven't heard of anybody being pulled out. Most of the families are pretty grateful that their loved one is able to be in that type of supported environment. Any other questions on supported living?
What, and this may not be related to this, but what is Carl's plan, Vern and Amy, for raising money for supporting through the Broman Foundation, Carl Broman Foundation, for supporting this program outside of the 377 funding?
There's no change from where it is now.
Okay,
That was the same thing that was communicated to me by Catherine, was it's they're supporting what is happening now.
Yeah.
And just like kudos to Mark First and the fitness center. They have just really stepped up and above and beyond to make sure that they can support this program, not just even support it to make sure that the members are within Mark First are still able to do what they can. But I've reached out to Catherine throughout this process on any concerns as far as contract language, the program, and there's absolutely no concerns with Carl taking it over. It seems like the program is supported. Vern, you would have more knowledge on the charitable foundation, but Catherine did mention that the charitable foundation is still doing their part and supporting the program. So it sounds like it's going to be just fine.
Well, the local foundation will continue to operate as it does, and all the money that's raised here stays here, just like it did with Advocate.
Awesome.
Let's hope it all continues. It's
Oh, it
just,
will.
Yeah,
it's all brand new.
sounds very positive.
Yeah. Yeah.
Yeah, and the fitness center, they even said part of their, like their mission, that's why they decided not to charge any of their members those 2 months, was because that was part of their mission. But yeah, they've definitely been extremely supportive through COVID within the community. And so it sounds like it's going to continue to go really well. And as far as the fitness center, so this was for Q1 for all of the other programs except for the fitness center. So that contract did just end March 31st, and then the new contract was successfully started April 1st. And so that's why you'll see all of the numbers Q1 through Q4 for partnerships and health, is because they were on a different schedule. Just a reminder, this contract for this year will go April 1st through December 31st. And so they can apply for further funding in 21, and they would be on a regular contract cycle. Any other questions on partnerships in health?
No, there was a bit of a report by Catherine, I think, that showed what the results had been, and they were, even given the issues we faced, it seems to be pretty good.
Yeah, yes. March 1st, pediatric therapy, they are just continuing to evolve and transition as they're moving buildings. And then also with just the challenges of trying to provide the therapy to families and the children, and some of those have to be in person. And there's been a huge deficit in fees for services because there hasn't been as much participation from the families due to COVID. But I think they're also just taking this time to be able to evolve and improve the program. And so hopefully once we kind of get through COVID, I think they're going to be doing some really even more amazing things. But any questions as far as the pediatric therapy program?
Are they trying to come up with ways to serve these without bringing them into the building? If
Yeah.
Parents are saying, well, we're not going to come in.
Yep.
And what that might do for us as far as funding in previous years too.
Yes, so they have definitely provided some of the telehealth to the families that were able to receive telehealth. But then you also just think of some of the things as far as like physical therapy, some of those therapies, like they really need to be in person. But where they've been able to provide telehealth, they've definitely provided telehealth. The other challenge, and this is across the board, not just in pediatric therapy, but kind of like in mental health right now, especially for children, like the families are kind of tired. It's summertime. And so some of the families they're tired from COVID, just from all of the stressors. And so they kind of are just taking the summer off. And so it's been a lot less services provided because of COVID. And then the families just not seeking as many services right now. So hopefully in August, if we can get back on a routine and a schedule and be able to provide services more in person, especially in the pediatric therapy, hopefully some of those families will have more energy to engage. But it's definitely just been a challenge with getting families engaged, and some families just want to break and not have to worry about those things over the summer. But that will definitely pick back up as, summer comes to an end and we get out of our head. But they also have been providing some of the non-billable services as those families that were engaged or are engaged. Visual aids, they've created visual aids to help the families with doing different therapies and to use with the children, because the children seem to respond better to having visual aids and visual props. And so like they're doing what they can to keep the families engaged and supportive, and respecting that some of them just, don't want as many services right now until summer's over.
But they'll certainly have more space and more opportunity for lots of expansion of the kinds of therapy they provide.
Yes, and they're definitely utilizing this downtime to get people trained, to get that set up, and so they're being wise with their time. Has some consequences of not being able to provide as many services as they expected that they would be able to provide. Any other questions on pediatric therapy? Supported employment has definitely been a challenge, but they are getting into, as far as like attending some of the school meetings, the IEP meetings. They were able to do that on Zoom. They were able to provide some respite for families of the youth. They are, as far as like the supported employment, they're starting to do more Zoom calls, emails, conference calls, checking in with employers, making sure employers are still willing to support the program. It sounds like some of the individuals in the program were able to return to work recently. And then just a reminder that because the program needs has shifted so much, and so many of the workers in the supported employment program were utilized in the CELAs and the community homes, that that is still existing, but that is where supported employment is currently at. So they're just trying to still figure that out on how to support the individuals in the program that need the support while keeping them safe, and then also where some of them can return to work, and then how they can support them as they return to work. They're also working on that.
Do you have any feel for what percentage have been able to return to work? Or, I mean, even the non-disabled were laid off, so I can imagine that this is true. And we may see a significant change in what the proposals look like in 2021.
I agree, Vern. They said a few was able to return to work, so I'm assuming it's a very small percentage that have been able to return to work at this point, but I wasn't provided with like an actual percentage or an actual number. But no, I totally agree that the employment landscape overall has definitely changed as a result of COVID. And so then for those that have a developmental disability, it's changed even more so. And so I agree, we'll see what the proposal entails for this program for 2021, and using March 1st their expertise and their professionalism of how they kind of view what this program is going to look like in 21 will definitely be interesting. And I'm assuming it's going to be different than what it's looked like any other year.
Are there any hints of things going on at the state level here or in any other programs for the disabled because of the COVID?
What was the first part of that question, Vern?
Are you seeing any hints of any potential changes or new things or innovations from the state or federal?
Yeah, there's definitely a lot of advocates in the developmental disability work. And it seems like a lot of that focus right now is on keeping those individuals safe and getting them through COVID. So it seems like it's at that basic need level that I've seen some of the literature and some of the programs versus even kind of like at that higher level past those needs. So right now it just looks like it's very just physiological needs trying to be met right now and advocated for individuals with developmental disabilities.
Sure.
Any other questions on any of the reports?
Good discussion.
Yeah, thank you.
Yeah, no problem.
Since there is a problem with the entire population of isolation causing mental and emotional issues, are we getting good support from from agencies that the Board of Health and contracts with and agencies that serve this population? Are they cooperating, trying to get our IT or developmentally disability people in?
That's a really good question, Mary. So as far as just the general public and
Sorry.
no, you're fine. There's definitely a lot of discussion on, I'll give her a second.
Okay.
Okay, so there's definitely been a lot of discussion on just in general in the mental health world that people that had maybe mental health challenges prior to COVID, those are definitely exacerbated. But individuals that may have never really shown symptoms of mental health challenges are definitely showing symptoms of mental health challenges from all of this just your pot. They want to talk to you, Mary.
It's McLean.
Just all of these challenges from COVID and just all the uncertainty that comes with COVID is affecting probably all of our mental health. But the interesting thing as far as like individuals with developmental disabilities, like we've talked before about like there's definitely that need for them to have their mental health needs met. And one of the challenges with individuals with developmental disabilities of getting their mental health needs met is that there's oftentimes it's harder to be able to communicate to mental health professionals what is going on with them. And so it may be like a lot of times it could come out in how they're acting versus in what they're actually communicating. So many of those behaviors are communicating, like I'm anxious, I'm angry, I'm struggling, I'm sad, I'm frustrated. And so I'm really hoping, and so like March 1st is kind of creating a behavioral health program to be able to better help support individuals with developmental disabilities. And that's something that's very new and I don't think it started yet. So that will be interesting to see how that plays out. But I'm really even hoping that as far, when the funding, the RFPs come out in a few weeks, that even agencies that don't only serve individuals with developmental disabilities step forward and there's a focus on meeting the mental health needs of individuals with developmental disabilities because their needs and challenges are going to be more even significant than someone that doesn't have a developmental disability. There's going to be, if when trying to address their mental health needs, those appointments are going to take longer. There's going to be a need for more support. And so we'll see how that plays out, and hopefully someone will be able to step up and say, you know, like, we'll really make sure that we help support these mental health needs of these individuals, specific to individuals with developmental disabilities. Because so much of the Board of Health funding is really going to cover a lot of it can cover individuals, absolutely, that go to the psychiatrist or see mental health, that have developmental disability, but it's really kind of more focused on just the general public.
Well, that takes me to a point that I've been thinking about prior to this meeting, and that is that should we be even thinking more as a 377 board when we introduce what our requests for support are, including are things like, how can you help people with just developmental disabilities and just simply lifestyle? I mean, how, you know, I've had to go through a lot of things each of us have in terms of coping with this and how we change our behaviors. And that same thing is even more so probably for those that have the developmental disabilities. So you mentioned March 1st. Well, how do we reach out and find out who's doing this, who's ready to do this? Is it portions of it that come from different ones, or what are we looking at it? And I struggle with that because I'm not exactly sure how to even point it out, other than that's something I would really look at to do a slice of dollars to be able to focus on that for our clients.
I absolutely agree, Vern. And so even like looking at, I just put together like a very simple document to kind of like look at what we could possibly look at as far as focus areas for calendar year 21. And so I think kind of like the starting of that is if we have an area that is specific to COVID-19 supports.
Mhm.
So that's, you know, because of increased mental health challenges. And some of it is just very logistical things as far as like keeping yourself safe. And so wearing a mask is not comfortable for anyone, but when you have a developmental disability and you have a stronger sensory challenges, and that discomfort is even harder to deal with. Some of it is even like coaching through how to wear a mask in public to keep yourself safe, or how to handle the smell of hand sanitizer do it's so strong. And so like some of it is just very logistical things that the general population may not have as many challenges with. And so I think having that COVID-19 section saying like, hey, like we really want you guys to tell us like, what can you do? What can you support these individuals, regardless if they're in a CELA or they're not, like, what can you do to reach out and support these individuals because of COVID, I think is a start. Yeah. And we can kind of go from there and see like who does reach out. And if it goes really well, then maybe that's part of that answer. And if it's, you know, if the board still feels like, no, like this isn't enough, like we really need to reach out more, then maybe that's where kind of like how you guys did the initiative with the partnerships in health, kind of, you know, put a program together and said, here's a program who can do this. Then we may have to look into after this, we may have to look at, you know, a program initiative to really try to invite agencies to look at it. But I think we have a start, and then we can just kind of see, we know there's a need, absolutely. So we have a start with this, with the funding being allocated for 21. And I think it's just kind of seeing who comes to the table, and if it's not as successful as what the board would like, then we can definitely troubleshoot and look at other options.
Well, it could be that, as we kind of talked as we went through the review of the programs, that it could be a shift in how those programs are structured, or how some of it is structured in a new way from our current receivers of money. And it may be that we attract people that we wouldn't even think of perhaps, and can come to us and say, here's what we're doing. We can help you with this.
Absolutely.
Yeah.
Yep. I think that will be in the application, and that will be an expectation. We know COVID exists now. We know it's still going to be here in 22, or excuse me, I'm skipping a year. We know it's still going to be here in 2021.
Yes.
We're hoping that there's a vaccine. Like, we know it's not going anywhere. We're hoping to, to be able to get it under control. But I think that will definitely be in the application, and that will be for the programs that exist and that will exist in 21 for funding. That's going to have to be an expectation of what are your plans? So depending on what phases we're in with this, if you can't do in person, what else are you going to do? If you do in person, how are you keeping people safe? How are you addressing the needs of COVID-19? For the Board of Health and the 377 board, is going to have to be an expectation for the agencies to meet.
And I think it'd be helpful for us as well, and you're working more closely now with the Board of Health, that we would know what it is that they're doing, what their focus is, because they're seeing the same environments that we are. So I think we've already gotten into our 6A of looking up funding priorities. So yeah,
Absolutely.
well, I'd be happy to hear from my colleagues on the board what some of their thoughts are.
This is Phyllis. I definitely think we need to keep exploring opportunities here, because there is so much need for services of this kind. And as time goes on, it's just going to get worse, I think. I mean, the need is going to become greater. That's what I mean. And yes, it will be worse. So anything we can do to provide help to this population is certainly money well spent.
I think this is one of the challenges we face, and yet it's an opportunity.
Right. I was really glad to hear all the things that the Health and Fitness Center is doing to help the people in the Sillas, because even though I think even when the facility was closed, they were still providing services out in the yards, and so thanks.
Is there any group of people or professionals that work with mental health or counseling that could be pulled together to provide Zoom type counseling? And I realize psychiatrists, psychologists, we need to pay, but is there any need community wise? With the Partners in Health, there was an organization, and we could work or have March 1st or presidents go into that. But is there any way we could help implement some type of a group of people that are available to talk to this population on an organized system? And I don't know in this environment how busy school counselors are. Are they working with students in the various schools that are identified as needing help? Or do they have some extra time? I'm not familiar with what they're requiring or what's on their platters at this time.
Amy, does the mental health group, are they focusing on this aspect of service?
Yes, absolutely. So there's kind of several different things that came into my mind when you guys were talking. And so the Board of Health has the embedded school program is for individuals it's a mental health therapist within the schools for the kids that have those extra mental health needs beyond even like what the school would provide at their basic counseling services. That's more specific to school needs. And so that program, again, like families aren't engaged right now because of summer, but the schools are like, I think between the schools and those embedded school therapists, like they are gearing up for when school starts in August, because there's going to be so many mental health needs that have to be addressed before even academics can be really addressed. And so I've had conversations with schools and with the therapists. And so the teachers are warned, like, and it's not just the kids, it's the staff that have their own mental health needs also. And so they're going to be, come August, they're going to be extremely busy with trying to provide academics in a different way, but also they have been very clear in saying, we have to build up people's mental health and their resilience before we can even really truly get into furthering academics, and we're gonna have to review things. So then you have kids in the schools that have, you know, developmental disabilities. They have autism, ADHD, visual impairments. They have whatever is going on, and that adds extra challenges within the school system. And so it would be really awesome if there would be a program that would be within the schools that would be specific to kids that have some type of developmental disability. And so they would really be able to, kind of like how the embedded school project is really with the kids that specific to mental illness, a program from the 377 board within the schools that was really supporting those kids that have some type of developmental disability, and helping guide and support them, and helping them be their advocate even within the school and communicating to the school. So we talked a little bit about that even during the last meeting, but that could be on just referencing what the funding focus areas for calendar year 21 under youth services. That could be something listed as a possibility, would be providing programs for these children within the school. And again, it would be specific to children with developmental disabilities. The other thing too, I was thinking under adult services, kind of one of those parameters could also be utilizing like what Mary's talking about, as far as like utilizing counseling, Zoom services, whatever would best meet the needs of individuals with developmental disabilities, meeting their mental health needs. And as far as like that group available coming together, one of the expectations even from the Board of Health is they're really looking at collaboration. So we can include that in the RFP, like, you know, there may be special attention to collaboration. And so maybe if agencies can get together and say, you know, like we'll work together or do whatever to provide services to help meet the mental health needs of individuals with developmental disabilities. We could definitely put that in the RFP.
Should we even think about every RFP that we have, that we need to have included in that, how this program is going to be dealt with within the environment of COVID-19?
Absolutely. Yep. That will be part of the RFP. That will be clearly stated in the RFP. And then also in the application saying like, please tell us, you know, what accommodations are going to be made as a result of COVID-19, giving very specifics as to how the program is, because we know in 2021, it's not if COVID exists, COVID is going to be here in 21. So it's going to be like, give us specific details on how this program is going to be successful and how it's going to be evolved, is going to accommodate those COVID-19 needs.
Yeah, they're already changing as we speak right now with what they're doing already.
Right.
Or trying.
Yeah, and I think in 21, it will be having that plan set versus in 20, it was really evolving and changing and trying to get a plan. And it's been keeping up, okay, like what's going on now versus this is probably just going to be the normal. In 21, this is going to be normal.
And I think I really support what I heard Mary talking about earlier. And does that lead us to saying, okay, what is it that we, the 377 board, need to take the leadership on to develop something new? And we don't know what it is yet, but we kind of know what the whole end point might be, and set some money aside for that perhaps. And I have no idea how to frame that yet, but, and then we can reach out to some of the other ones, like the Board of Health and the mental health group and other agencies and schools, universities and whatever. Yeah.
No, I absolutely agree. I think, with this RFP process, like I'm super excited to see what comes forward. I'm really hoping that agencies that the 377 board hasn't heard from before it comes forward and there's new initiatives. So I'm really excited to see what comes forward. But the other piece of that too, and just to be sidetracked for 1 second, I did share with Vern that there's approval for sustainability of funding a behavioral health specialist within the behavioral health program. And so my program has grown from me and an office associate to one more person. And so that individual will start on August 17th. And so I'm really, really excited for this person because I have so many visions and things that kind of started, but like I don't have the time capacity to do everything. So I'm really excited for this person. And one of the things that this individual will be tasked with is really starting, there's so many agencies and groups within McLean County that is doing things for individuals with developmental disabilities. And I have some of their information and some of their names, but I haven't had the chance or the time to be able to really reach out to them and say, hey, like, what are you doing? And how can I bring this to the 377 board for their knowledge? And we can start kind of exploring all of these things within McLean County that's happening. And so that will definitely be one of the goals that this individual will be guided in doing, just to kind of have that 377 board presence within the community, and then also having just the 377 board having more knowledge on like, this is what's happening and what can happen. So yeah, I'm excited for a lot of things. I think the 377 board has tons of opportunities coming within 20 and 21. So I'm really excited for those things.
Do you have enough information based upon the really good discussion that we've had today to frame up something in this areas of focus that, and then embedding in that some of the things that we've talked about?
Yes.
Like, particularly to embed in that they really have to deal with the COVID-19 and tell us how that's going to change and what's going to happen. And then maybe something that we use ourselves as an initiative to research and to start and to try to build in collaboration with others. And I don't know what that is yet, but
Yep. Yeah, and I'm on the
you're
same page.
smiling and you are excited.
Yeah, I am very excited. I love developmental disability things, but extremely excited. And I know I'm with you. I think like we have this task, the RFP task ahead of us now. I definitely feel like I have enough language, enough of your guys' insight to move forward, to be able to provide what you guys are looking for. And then I think past that and seeing how that goes is then going to give us some more clarity on like, okay, now what can we do?
So you could get a draft out for us to respond to, so that we're still within the framework of what the schedule is in August.
Yep, I will get you guys that draft out early next week is my goal, because I have to do the same for the Board of Health. And so like there's these late minute discussions, but we'll definitely still be on board with getting everything out on August 10th. So I will get you guys something, a draft saying, here's what these funding focus areas look like. Please quickly review them individually. And if you have any suggestions or feedback, get that to me soon. But I think that it should be fairly easy and working with you guys for this amount of time. I know your expectations. But no, I feel like unless there's any other things, so this is kind of the 6 funding focus areas I'm really going to look at. And I'm going to put these in the RFP, and then they'll be able to say like, and looking at this funding focus area, and then they'll be able to do the application. But no, I will definitely get that to you. And you guys think of anything next week that you want to add?
Well, I think the categories are there unless somebody's seeing another one, but it's within those categories that, where the change happens.
Yeah, absolutely. And I like the categories this year where I feel like it's not too restricted. I think we may have been a little restricted last year, and I know Vernon and I have talked about this, but I really categories were like, there's still expectations, you know, this is still what the 377 board is looking at, but we're also not restricting them so much where they're like, why am I even going to apply? Because I'm not going to fit into this. So I'm very, very hopeful. And I've, of course, had conversations. I always have conversations and promote the 377 board to agencies. And have you thought about this? And make sure you look into the funding. So fingers crossed.
And it's not part of the RFPs or whatever, but I do think that as a board, we can come together and on our own decide as we go forward, what is it we should be doing and looking at all to bring more in, and to identify and to focus on this, improving the life opportunity, the lifestyle of people with COVID or people with developmental disabilities within this COVID environment that's here, and it's going to be here for a while. So.
Yep, absolutely.
I think the one thing that we have been, and I think we certainly need to focus this year, is that we have to be flexible and we have to be ready to make changes because I think we're going to see all kinds. I mean, we change every day. So I think we have to remember that we have to be flexible as possible within statutes and within the bylaws. But this will be a year of change for sure.
Yeah.
It's a good discussion, and I agree with everything that's been said. It's going to be an interesting year.
Okay. Does that wrap that up? Then we'll look forward to your first draft, and we'll get back to you and help you continue with that.
Another question out of the blue, and that is, this summer been doing, and all of us are faced with information on the systemic injustice of Black people not being, and other minorities not being included within our system of who we support in Mark 1st. How many minorities, what is the population of, whether it be Hispanics, Black people who receive services? Has that ever been investigated or studied? You're on mute, Amy.
So demographics is part of what is reported in the quarterly reports. So I'm going to look, it'll just take me a second to get to that. The other thing too, just like as we were talking about COVID being included in the application process, this is a discussion from like the Board of Health, the Mental Health Advisory Board too, as far as like equity, inclusiveness, using trauma-informed care principles to ensure that everyone is feeling safe to engage in the program, regardless of race, background. And so I'll definitely make sure that's part of the 377 board's RFP process, the contract, and also just following through next year with show us what you're doing. Like, I want to see, you said that you're going to do this in your application. Now please show it to me. Will definitely be an expectation in 21. Is it 21? Yeah, next year in 21. Goodness. But if you can give me 1 second, as far as in Q1 on those demographics. So as far as like the pediatric therapy program, let's see. So most of the individuals were male, and let's see, of 310 that were served in 2020, that were served first quarter, January through March, in the first quarter. So 310 were served, 20 were African American, 29 were Asian, and 261 were Caucasian. So there was a very significantly high number of individuals in pediatric therapy that were served that were Caucasian versus the smaller percentage of African American and Asian. As far as the supported employment program, there was a total of 146 served. Of the 146 served, 14 were African American, 3 were Asian, and 129 were white. So again, a higher percentage, significantly higher percentage served were white. For the supported living program, a total of 48 were housed. 4 of those individuals that are housed are African American, 1 is Asian, and 43 is white. So that would be the individuals living in the CELAs. And then as far as partnerships for health, a total of 23 were served, 3 were African American, and 20 were white. And then as far as Easter Seals, the last program and their demographics, and this is again for quarter 1. So they served 7 for quarter 1. 1 was African American, 1 was Asian, 3 Caucasian, 1 identified as other, and 1 identified as unknown.
Well, that's not something we can necessarily address ourselves, but we need to be aware to make sure that the system, as people come through, that it is open, that the minority communities feel that we are accepting and open. That concludes my question on that.
Okay, well put. Okay, we've got almost a half an hour left. I think that's plenty of time for us. Move next to the election of a secretary to serve until July of 2022.
Who's the present secretary?
I think, Mary, are you not the current secretary?
No, it's either Phyllis or Jan.
Oh,
Yeah.
it's
I think it's Jan.
Yeah.
She just asked.
haven't you been receiving a check?
How'd you like my job? I mean, well, no.
We
Something
have,
else.
we have it as Phyllis.
You have
Oh.
this, Phyllis.
Okay.
Congratulations, Phyllis.
Yeah, thanks. I
We have it
worked hard
as Phyllis
too.
up to this point.
Okay.
Phyllis got the check, not me.
Yeah. Well, then I nominate Jan Hood.
Well, can you serve more than 1 year?
Yes.
Amy said yes.
Can we do both nominations at once? And I just nominate that the secretary and current secretary and current president, your chairman, continue for another year.
Keep stability in our organization.
Then I withdraw my motion.
We would have to do one. We would do that. And well, we would have to do the secretary and the president separate,
Okay,
as far as action items.
Okay, so I'm supposed to nominate Phyllis, is that right?
yes.
Okay.
For a second.
Second,
Okay, there's a nomination for Phyllis in a second. Any other nominations? Hearing none, a motion to close the nomination.
I so move.
second,
Approved?
aye.
Yes.
Aye,
Congratulations, Phyllis.
yeah.
Yeah.
I expect to see that check in the mail.
I feel a nomination coming forth for Vern for president. And Vern, is this something you're willing to continue with? You're doing an outstanding job, and it does provide stability to the committee for you to continue.
I'm willing to do that for a year.
I second.
I second.
That's good to hear. Thank you.
Mary seconded it first. Jan and then Mary.
Excuse me. Do I have a second?
The nomination has been closed. Or motion to approve. Or the voting to approve. All in favor?
Approve.
Aye.
Aye. I'd like to see those minutes.
I think I was elected. All right. Thank you.
Thank you.
I'd like to see something in the minutes that says how much the board members appreciate all the work that Vern does.
Yes.
We can do that.
Thank you very much.
Thank you.
It's a
We
good
are
board.
We are where we are today because of Vern's involvement, his expertise in the Advocate Charitable Foundation and so forth. Thank you.
You're welcome. I'm happy to do it. And I'm like Amy, I'm excited about the year ahead in 2021, and I know you are too. I agree. We need to be flexible because you never know what's going to pop up, and you've got to be able to respond to it.
Absolutely.
Yep.
Can we do that?
Go ahead.
Sorry, Vern, can we get the action item for, gosh, the very first action item on the funding focus areas with just the, whatever that I will send, so just approving those 6 funding focus areas as number A on items for action, and then of course with the caveat that I will send you guys the email with the draft for your feedback, but just so it can be official.
Okay. Someone want to make a motion to that effect with the 6 categories, and Amy has the responsibility to develop a draft for our review.
I so move.
Thank you. Is there a second?
I'll second it.
All right. All in favor, say aye.
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 Any opposed? Motion is approved.
Thank you, guys.
And now I think we have the April 16 minutes to approve.
I move approval of the minutes as printed.
Thank you. Is there a second?
I'll second it.
All right. Any discussion on that? Hearing none. All in favor, say aye.
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 Motion's approved. I read them. What's what I remembered, so. What else? Anybody have anything else to discuss? Any other business?
I have several items. First of all, I don't know, but I didn't receive a notice of this meeting, and so out of panic, the early morning call to Mary, and she helped me out. I don't know if my email, it's in email land somewhere, and it didn't arrive to me. I started working late on this, and I thought, oh my gosh, are we meeting there? I mean, why am I not getting this? We've got other things, and then of course, after 6 o'clock, it's not a good time. So if you could check that out.
Yeah, we'll definitely check that out. So on the calendar invite, there was a calendar invite from me. Let me look real quick on
Yeah,
your
'cause I searched and I went into my spam and everything.
It was in very early July.
No, well then Mary,
I got one from Jeffrey
right.
Yeah.
the-
Paternoster.
that's what Mary forwarded on to me. Because in that is how we're gonna get in the meeting, and so it's not, it's just, you know, that's okay.
No, we'll definitely send you, because on our records, it looks like you would have received something, but yeah, there's definitely a concern if you didn't receive anything, Jan. And so
Make
what we will do is I'll send you an email, and I'll have Jeff send you an email, have you respond back just to make sure we have your right email, or there's not a problem with it going through.
Yeah.
So
If you don't put a dot in there, it goes to Jan Hood in Florida.
okay, and we don't want Jan Hood in Florida.
Sometimes I get it. And another thing I wanted to, this is nothing, this is a mental health discussion. It's not about disabled adults. In fact, it's about adults that are just fabulously talented. But HBO is just featuring a show. It's called The Weight of Gold, and it's Michael Phelps, who is the fabulous swimmer who got so many gold medals, and he addresses the disease of depression among the athletes. It's just astounding when you read this. I mean, when you sit through this, I couldn't move while I was listening to the whole thing. The very lack of support for these individuals. When all is over, there's nothing for them. There's nowhere for them to go. There's no support. It's just it's incredible what's happening to them. So I think it's, like I said, it's a mental health. It addresses depression, and it's so sad. And it's on HBO now. It's just starting. It's called Weight of Gold. Okay. Amy, you're on mute again.
I just said thank you, Jan.
Yeah. That's it.
Anything else?
I just want to quickly do a reminder that, and actually, that soon you guys will be receiving the completed applications. And so I will get you, and I'm just actually, I should have done this beforehand, looking at your guys' funding timeline, and I need to make some adjustments to the funding timeline. And so my apologies for not making those prior to putting them in the packet. So don't look at the funding timeline very closely in the packet, or else you're gonna get more confused. So I will get you those updates soon in email. My apologies, but then that way you can know when to expect the applications to be coming through for you guys to review. But just a reminder that we will meet again on October 29th, and those will be the presentations. And then you guys will meet on November 19th, and then that will be to approve the funding.
Will that be by a meeting or Zoom?
It will be, I'm 99% sure it will be Zoom. I'm trying to recall an email that said that the remainder of the year, the county administration said the remainder of the year that virtual meetings will be available, and so we can continue to meet Zoom. And so actually that proposes an interesting challenge, or we're going to have to look at how to do presentations via Zoom and meeting Open Meetings Act. So I will look into that.
Well, we have the documents ahead of time,
Yes.
and they would be on the screen just like everyone else, so.
Do we have the same program for going in and looking at the applications and all of or has it been made more user-friendly to get to all the detail?
A lot more.
No, that program wasn't going to become more user-friendly unless it just wasn't going to become more user-friendly, and it was extremely expensive. So we ended the contract with that program. You guys last year you received the applications. Everyone did the applications using Microsoft Word document. and then those were emailed to you. So it will be really user-friendly in that it'll be a Microsoft Word document, an Excel document with the budget, and those will be emailed to you to be able to review.
Thank you.
Yes, but the program no longer exists.
It was very difficult for those of us who are technologically disabled.
Well, Mary, don't feel bad because it was very difficult for those that were very technologically savvy. It was difficult across the board. And so just to back up to, like, I'll check with I'll talk to Jessica McKnight and then see if we need to talk to legal. So you guys have the login to be able to log in to the meeting. And so the public doesn't have the login information because they can't log into the meeting, but you guys bring up a good point as far as the presentations, seeing if that would be public participation where we can provide them with the login so they would be able to log in and present that way. But I will check into it, and I'm pretty confident I'll have an answer before it's needed, but I'll work out the logistics. I know that the presentations are beneficial to you guys.
If we need to meet in person and for the presenters, the agencies, you know, we're not that big of a board that the county boardroom or someplace within the county, we ought to be able to meet in reality and be socially distanced. And I would be supportive of that.
Okay.
Well,
I'll-
I know when we're on
Some of the
Zoom,
board committee,
Amy, when
some of
we're
the
on,
board committees have been meeting in person, so we should be able to.
Yeah, there has been the option of meeting in person. Sorry, Jan, go ahead.
in Zoom meetings I've been on, there's always an administrator who's giving permission to people to participate on the Zoom, in the Zoom meeting. And I assume this might be the same thing. So somebody, if the website would get out and somebody would try to get in the meeting that shouldn't be, the administrator can deny them access.
Okay.
So,
Yeah, these are all things that, and I know there will be safety measures that Scott and Craig will make sure that it's communicated. Like if it does end up working out where we can do a Zoom meeting for the presentations or a go-to meeting for the presentations, make sure it's communicated to everyone how that will work, including the agencies. And then if it's not really feasible to be able to do that, and we need to meet in person, there's plenty of space in the room that the Board of Health meets at in the health department, where everyone will be able to practice social distancing and wear masks and stay safe. So virtually would probably be the best because we don't know where we're going to be at with COVID the end of October.
yeah, for sure.
But we'll figure it out. We'll definitely figure it out.
That's usually a fairly long meeting.
Yes.
I
Yes.
mean, it's not till evening, but I mean, it's into the middle of the afternoon. Yeah.
Yeah. Yeah. And it depends on
We may get more applicants this time.
exactly.
Yep.
Yeah, we'll get it. We have time. We will get it planned out.
Okay.
Thank you for your good work, Amy.
Thank you, Mary. I appreciate that.
Yes, thank you. And by the way, we're so glad you have another staff member too. That's great.
Yes, I have been asking for this person for about a year. I know that you guys would be shocked that I was on it like a dog with a bone. So I am very perseverant. So I am so excited, and she seems absolutely amazing. So, and the new office support specialist, Jeff, is absolutely amazing. He's more technologically savvy than I am, which doesn't take much. So yes, I'm just so excited about the program and the opportunities.
Fabulous. Yep. Perseverance helps then.
Yeah, I like to call it perseverance, Vern. Some other people might have a different,
Well, that's all right.
that's okay.
It's called How Do We Say No to Amy?
Right. I can still be back. Yep, yep. There's
should-
that.
Everybody's participation. This was a good meeting, a lot of good discussion, and
Yes.
I look forward to.
I like meeting virtually.
All
'Cause you can
right.
do everything and it works really well. But I like,
I'll try to get the camera working next time.
Yeah, we need you. We need you in a frame.
That's okay.
Okay.
I even took a shower though before this, so. Anyway,
next time we can be in the shower.
right,
Phyllis, we'll put that in the minutes. Phyllis Bayford.
that's okay, yeah, that's okay.
A motion to adjourn.
I so move.
A second.
Second.
All in favor, say aye.
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 Thank you all.
Thank you, guys. Have a great weekend.
Be safe.
You too.